Hello, this is the Beach Barbell podcast. I'm Nick Markey, physical therapist and trainer at Beach Barbell in Wilmington, North Carolina. It's Thursday, October 24th, 2019. Today's question is, can words hurt you? I'm speaking in the context of healthcare, physical therapy, the medical field. Doctors, chiropractors, physical therapists, acupuncturists, massage therapists, nurses, anyone seen with some sort of authority in health and medical and wellness. People will often take the words that they hear from them as being perhaps the end-all be-all of the situation, without realizing that that provider or clinician is a human being, and human beings are not always correct. And oftentimes people won't look at it like a situation where you're just receiving advice and you need to perhaps get advice from other clinicians or people to balance the different pros and cons and ideas and see how those fit into your life. More specifically, though, when medical providers say things that promote more fear, more anxiety, more self-doubt, those, I think, can be harmful. These words could be things like, you're bone on bone, when they're talking about some sort of arthritis, or that's the worst x-ray I've ever seen, or you have degenerative disc disease, which is just fancy words for arthritis in your back. And we've talked about before how what we see in imaging in terms of things like that, like degenerative disc disease and herniated discs, the imaging doesn't always correlate with what kind of symptoms someone feels or severity of symptoms. Someone might have a mild disc herniation or arthritis in their back, but they might have severe symptoms. Someone may have major herniations and arthritis in their back, and they may have no symptoms. So it's an error to tell someone that what they're feeling in that situation is because, for sure, that thing we see on the image. Now, to be clear, not everybody that hears words like those are going to suffer from it, but we have to look at how does it alter that person's behavior. So if someone is told that they have some sort of damaged part in an area that maybe they feel pain, the choice that person makes from then on will determine whether the words damage are hurtful or not. So those words would be hurtful if that person stops maybe doing activity because they're afraid of the damage that they've been told they have. Since we know activity is a large part of healthy living, if you tell someone words that gets them to stop doing activity, then you may very well be performing a big detriment to their life. Now, if someone's having quite a bit of symptoms with maybe a certain activity and we can modify it or maybe do other activities in its place to allow that area to calm down, then sure, that's totally fine. But the words damage don't need to be part of that. In fact, you're better off saying, look, the part seems sensitive, particularly with this activity. Why don't we see if there's a way we can maybe make the activity a little easier, a little lighter, modify it, or maybe we just need to hold off that activity for a short while and focus on other activities. Then we'll be able to gradually get back into activity as that area calms down. See, those words promote more hope and recovery instead of damage, especially if you link damage to pain, which again is an error because we know that damage and pain don't always correlate. So to assume that they are in almost every situation is a big error on the medical provider's part. But you say damage to somebody and then they have pain and they think that every time they have pain, they're damaging themselves more, then you might put them down that rabbit hole where they just stop doing all activity. And providers don't sometimes understand this, that the words they say and sometimes don't say add up to bad situations or bad choices. To be blunt, oftentimes people need a green light. That's what they're seeking when they go to a clinician. I'm having a problem. I need to know how serious this problem is. What do I need to do differently in my life? Or what do I not need to do right now? Or whatever. The provider, being more of an objective third party, listens to the person's history, thinks about, the potential red flags, serious bad stuff that could be, the low chance thing that could be there. Since it's a low chance thing, oftentimes you're not going to be the first thing you're going to bring up because it's most likely not that thing, terrible thing. And then based on that, an assessment of, the area, what you can do, what you can handle, what you like to do, and then coming up with a plan together to keep living their life fully that they can handle. So this takes some time. This takes paying attention to the person, actually talking to them and hearing them, and not just clicking boxes. And you'll find that oftentimes when you talk to somebody about a thing, you help them calm down about the issue. You help them get clarity on what may be going on or most likely is going on. And then they can move on with their life. And you can do close follow-up with them so that you can review things, you can check on the status, you can, update the plan, lots of cool different things. So it's going more towards somewhat like a coaching relationship. You're trying to give them an action plan to move forward in their life with, whatever the problem is that they're dealing with. So what this could look like in practice, let's think about someone with back pain. We'll say a guy in his 40s with back pain. We'll say he started developing it a few months ago. And then, he likes to go to the gym, we'll say a couple times a week. And he's having the back pain when he does back squats and deadlifts, okay? So he's having the pain for several months now. Maybe it's just kind of lingering on, not necessarily getting better or worse. Some days are much worse than others, so it's kind of an up and down thing. This is very common. So he goes in to the doctor just because he's saying, you know what, I haven't been able to do, like, I've just stopped doing any leg work because the deadlifts and squats are what I usually do, and since those hurt now, I'm afraid that I might be damaging something or doing something wrong, and so I've just backed off. So I'm just doing upper body work. So he goes and sees the doctor. So the doctor is asking him about the history. Has he had this before? Does it bother his sleep? You know, how's his work and home stress going on? How's just life going on in general? You know, what kind of other things does he like to do? You know, just learning about the person. Asking about the history of this condition. Seeing if there's any other symptoms going on. We'll say in this case, there's, you know, occasional radiating pain down into the thigh to the knee. So that's a very common thing people will get when they have back pain. They'll get pain that sometimes goes down the back, kind of into the butt, down the thigh, sometimes past the knee, and sometimes down into the foot. Oftentimes this will be referred to as something like sciatica or something. Okay, so after reviewing all that, we'll say the doctor doesn't have any concern for something serious. No scary red flag type symptoms. So we're talking pain and radiating pain. So what should the doctor tell this person? Well, first thing is that the prognosis is very good. It is most likely this back pain will go well away on its own, given some time. Now, the bad news is that we don't know exactly how long. It could be weeks, months. You might be dealing with it sort of lingering on and off for maybe a year or two. But generally, most people will feel better. And the best thing you can do is stay active in the things that you tolerate. So I like to point out the positive things first that the person's already doing. Okay, so you're already staying active in the gym. So you didn't just stop going to the gym. You continued working out your arms. That's awesome. You know, at least you kept working somewhere. Okay, so now let's explore ideas for the lower body. Let's try, maybe the leg press, where you have your back supported basically in like a chair, and then you just push away with your legs. Oh, okay, there's a good idea. Let's maybe try lunges. You don't maybe use your back as much with the lunges. Oh, okay, there's a good idea. Let's alter, the exercises, and if those don't work, then maybe let's just work on more just knee exercises. So like you have, the sitting leg extension and leg curl, where you kick your knees straight and then when you bend your knees. So there's lots of different ideas and options to try. So pick one or two of those, go see how that goes at the gym, and just start there. Work at that for a little while. And then, after a week of doing that, maybe try one of the exercises at a lighter load that you did before that was more irritating, and just test it. Just do a few, reps or sets and see how it feels. And using the rubric that I like to use, where you kind of go through that flow chart of, do I feel in control? Yes or no? Yes, continue. Do I feel pain? Yes. Okay. Does that pain Is that something that I feel I can handle? We'll say yes during the exercise. Okay. And then over the next 24 hours, was what I felt over the next 24 hours acceptable in terms of pain or stiffness or whatever? We'll say yes. Okay. Well, then that exercise might be a reasonable one to keep doing. Now, if you are feeling pain with it, then you just give it a little bit of attention. Doesn't mean you have to obsess over that, but just give it a little bit of attention in terms of paying attention to what you're doing, and maybe just easily build it up. Don't worry about going up too much too soon. But if you're feeling you can handle it during the exercise and after, over the next day or two, then I think it's fine. And so nowhere in that conversation did the provider say damage. Okay. That's very important because, one, we have no idea if there's damage or what we might think of as damage, because oftentimes we just think of the muscles and all that. It could just be a few of the nerves that serve the back, maybe they're the direct nerves in the back, maybe they're the nerves that serve the back in the spinal cord, or maybe the nerves that serve the back in the brain. There's 3 chains of nerves. One or all of them could be sensitive. Maybe there is some tissue healing going on, and what if there was some sort of injury to the area? Not always, though. Not always does somebody have an injury where they start feeling pain. A lot of people just feel pain just sort of gradually creep up on them. So the important thing is that you're promoting action, you're supportive, you're encouraging, and you're listening. That person walks away from that appointment with a way better attitude, less fear, less anxiety. I have something I can do about my problem that I can handle. So, and then you follow up. This could be, by phone or email, in person, whatever makes sense for the provider and the patient. And then over time, most likely that person will get better. And if not, you just keep adapting, you keep adjusting. There is maybe a certain time where you might do further workup, but the question comes to, is that further workup going to change the plan of care, right? So if the person's dealing with back pain for many months or year or two, you get an x-ray, fine, that's not too big of a deal. Okay, we see maybe a little bit of arthritis in there. It may or may not mean anything. Okay. That doesn't mean they necessarily need to go to a surgeon or go look for a steroid shot, because those are more or less 50-50, about just as good as getting a saline shot. So just as good, more or less just as good as a placebo. Okay. So what are you going to do now? There's nothing abnormal on the x-ray. They're just dealing with some pain on and off. What more tests do they need to run? Is it going to change their plan of care? We don't oftentimes think about that. We just say, well, I just want to check it out. Why? Why do you need to check it out? What does checking it out do? I mean, I guess for some people that might give them maybe less anxiety when they've checked it out, like they've done something. I've got the x-ray, it says I got some arthritis, that must be it. Okay, oh cool, I'll just carry on with my life. Okay, that's fine if that's how they react. But most people don't react that way. Most people go, well, see, I got this damage and that's why I'll always have pain. And it's just not true. So a little bit of a long one today. Thank you very much for listening. Again, I'm Nick Markey, physical therapist and trainer at Beach Barbell. Check out beachbarbell.com if you're interested in learning about what we're doing with our gym. And I hope you have a great day. Bye.